Hi, I'm Dr. James from Trick One Aesthetics. Today I'm going to go over a fairly controversial topic and explain why we may say no to you when you come to us for treatment. The sign of a good practitioner is one who takes the time to explain and educate you in terms of what to expect and how the treatment will progress. At Trick One, as I've said, we pride ourselves on this. We have detailed consultations, we go over any questions, worries or concerns, and also we pride ourselves in educating our patients so that we have a realistic expectation from the treatment. So the aim of our consultation is to educate and set realistic and natural goals following your treatment. However, to maintain these high standards and encourage the fact that we are a natural look clinic, we may of course say no if we feel the treatment isn't indicated and in your best interest. Sometimes there are clear-cut reasons why a treatment is not indicated. So these include if you have an allergy, if you're pregnant, or if you've had a previous filler and, for example, it's too soon after your treatment and the risks will involve complications and the possibility of overfilling. Other reasons why a treatment may not be indicated normally come to light once you're in our consultation room and we're having that in-depth discussion. Obviously, these vary from person to person, but primarily I tend to focus on the body dysmorphia disorder and explain what it involves and how it can vary a patient's treatment goals. Commonly, patients come to clinic primarily because they've been advised to or suggested to by friends, family, or someone else. Sadly, the UK has a fairly unregulated industry around the aesthetics. This can lead to often some practitioners treating patients for the wrong reason. This leads to the things that you're seeing plastered all over social media, the overdone look and the unnatural effect. Now, you may say that some patients want this overdone look or unnatural effect, but from our experience, it's feeding into a bigger problem, and we as clinicians have to be held accountable to the treatments we provide. We are also responsible and held accountable by our governing bodies for giving our patients realistic and honest treatment options which are bespoke to their own facial structures and features. So what is body dysmorphia disorder? It's a spectrum, and I can't personally think of a single person who can look in the mirror and say, yes, I'm completely happy. And the important thing is to realize that that's normal. Now, the NHS classifies body dysmorphia disorder as someone who becomes fixated on their appearance and constantly analyzes and critiques them on features that everyone else can't see. As medical professionals, we've developed consultation techniques, as I said, that allow us to ensure that the patients are treated in the safest and most appropriate way. Overall, saying no can lead to quite difficult and awkward conversations for both the doctor and the patient. It will also lead to potentially a decrease in earnings. However, we will continue to say no if it means that we uphold our values and our belief that we should treat each patient with their best interest at the forefront. Of course, if we decide that a treatment is not indicated, we won't just abandon you. We will either advise and refer you on for a specialist, or we will refer you on and direct you to other online resources that may help. Of course, often it's saying no to the treatment that you've come in thinking that you want, but we may suggest other treatments that are more suitable and more in line with what ties in with the natural look that we're aiming for. So this topic, as I said, is a bit controversial and it can lead to some quite awkward discussions, but it's something that we believe is vital when part of the initial consultation. If you've been triggered or you have any concerns or any questions about anything I've covered, we will put a few links below to other resources that will help give you more information. And of course, we are always here and we are always willing to have a good in-depth conversation with you in clinic. Overall, I hope this was helpful and I look forward to seeing you in clinic, and I would love to have more discussions with you around this topic. And I hope that you appreciate that our end goal is to treat you as the patient with your best interest at the forefront and also aiming for the best natural look according to your own facial structure and features.